Jaclyn Martinelli. I'm the Care Service Administrator here at Evergreen Woods. I oversee our Nursing and Rehabilitation Center. I was able to meet up with my old high school softball coach, and one of his notes that he sent to me was, I bet you when you chose to become an administrator, you weren't signing yourself up for a pandemic in the year 2020. And I look back at how many years I've been doing this, which is going on about 18. No, that's not the case. But really, I feel that in the future, that it's going to make every decision that we make here that much easier. Because if we can fight a global pandemic in 2020, I have a feeling that all the other decisions that we make are going to get that much easier for all of us. So not only am I the administrator, but I'm also a mother, I'm also a daughter, I'm also a sister, I'm also a friend, and I'm also a coworker to many team members. When the COVID-19 pandemic first began, and it affected my life personally when we lost my brother-in-law unexpectedly from the virus in the beginning of April, my determination to protect our residents and our staff, I think, became more real and strong. So I look back at in February when we started to plan for the COVID-19 pandemic and look at our personal protective equipment and look at staffing and kind of plan for the worst. We had contingency plans that we still have in place. Our staff were preparing. Our staff were preparing on how they were going to be able to take care of those at their home if and when we became affected with COVID-19. If they had to stay here, who would care for their children? Who would care for their loved ones, their parents? And I really know, after going through a pandemic, how dedicated our staff are, from our CNAs to our nursing staff, to our programming, to our social work, to any of our department directors, to Dr. Capobianco, to Blair, to any and all. I could reach out to everyone and they would assist. Everyone would have dropped what they needed to do in order to see how we could protect our community here. Our staff and family and residents were very concerned. There were way too many emotions to be able to explain. Where there was fear, people were scared in regards to what would happen, and that the visitor restriction for people coming internally into the health center had a huge impact on families and residents. So we had to look at alternate means and continue to look at FaceTimes and Zooms and WhatsApps so that people had some sort of connection to their loved one, but that they were able to see their faces. I get asked often, how did we manage and still are managing through the COVID-19 pandemic to be COVID-free? So I really have to thank everyone who works here for being so vigilant in honoring and respecting the protocols and processes we put in place, to following CDC recommendations and our governor and state recommendations, but also from the epidemiologist at the state of Connecticut to Dr. Capobianco, who has been the leader for us for so long through this pandemic, and she continues. So following all of those recommendations and putting our own processes in place, which did not make everyone happy, and the restrictions were very difficult for many to be able to accept, I feel that it put us in a place, in a position to be able to fight the pandemic. I also feel that there's a little bit of luck and a little bit of some blessings from above that helped us continue the path that we are on right now and our goal to continue to be COVID-free. So new norm, at the beginning of the pandemic, our residents were asked to stay in their rooms. We're not going to be having communal dining and communal programs. So we had to bring the programs and the meals to them and kind of bring a life and an interaction and things to keep people busy and interested and stimulated, which our staff, I just can't thank them enough. They turned into the barber, the cosmetologist, the nail technician. Before we made decisions, we looked at how was the community doing with cases of COVID-19, and then we looked at the state and the CDC recommendations, and we slowly started to release our restrictions that we had for staff being able to come in. Now, we've slowly been able to add in communal dining and programming over the past couple of weeks. where we social distance and we still continue to wear masks, but it allows us to have small group programs and then a little larger group programs outside where we bring in entertainment. So we have some people who have never met myself without a mask. I am honored that people entrust us with their care for their loved one. Any decision that we make, we don't make it lightly. I always try to envision myself, if I was having a loved one in a skilled nursing center, how I would be being a family member on the outside. So I thank you for continuing to follow our restrictions and guidelines. It is our responsibility, what we take extremely serious, to be able to protect our staff and our residents from the COVID-19 virus. We have staff who are over the age of 65. We have staff who have comorbidities and autoimmune illnesses that put them in a position that they could be affected tremendously by this virus. So I always leave that with people who might not want to wear their mask fully on their face or who don't want to abide by 6-foot social distance. Those are the factors that we have right now, and the kind of what the CDC's recommendations are that are our best fight against this illness. So we are fully masked and we're asking for social distancing. So I thank you, because this fight is not over. We have a long road ahead of us to be able to fight, but we're ready for the fight, and we're gonna protect our team members and our residents as best we can.